Hello, Dr. Siddharth. It is a
Hi.
tremendous honor to have you
Hi,
on the
Akash.
show.
Thank you. It's great to be sort of, I've been going through your material that you've been putting up lately, and that's a lot of good work, man.
It means a
Bringing
lot, sir,
together
coming from you.
different professionals from all places. It takes a lot of effort, takes a lot of dedication, and hats off. It's good work, great work, in fact.
Thank you, sir. Could you do us the pleasure of
Hi,
introducing yourself, please?
absolutely. Hi. So I'm Dr. Siddharth Chowdhury. I am a psychiatrist by profession. One of my primary functioning areas, other than looking at patients on a daily basis, is that I'm currently also working with an NGO called World Health Partners, where I function as their mental health specialist pan India. We're currently trying to get the Indian government to bring in, the whole mental health perspective into national programs. जैसे TB का program है आपका, you have the National TB elimination program. We're trying to bring in a bit of work with anxiety and depression. ताकि जब screening हो रही है for a TB client, you also have, some kind of work being done on mental health. Same thing with the HIV program or other programs as well. In fact, I think in the last 8 to 9 months, we have ended up screening about 2.5 lakh people across the 3 states जहाँ पे हम लोगों को mandate मिला है. So, I was in active practice at Vimhans in South Delhi up till last September. But then I felt this need to go out and actually make a difference to mental health rather than कि मैं AC वाले कमरे में बैठा हूँ और it's no doubt feels really good to see patients and make a difference to their life, but mental health work really needs to be done and at the grassroots level, and
Right.
that is what we're trying to achieve. So yeah, I mean, psychiatrist by myself, mental health specialist trying to figure out how to work with the government. I also write a lot on mental health
Hmm.
in this platform with this newspaper called Rising Kashmir, which the editor of which happens to be a very good friend, the chief consulting editor. So he takes out these weekly features where he wants to talk about mental health challenges or other health issues. Otherwise, when we look at the coverage in the valley, it's always about violence and things like that. Nobody really
Hmm.
talks about health and other things. So we've been trying to make a difference via that as well. And yeah, I mean, things are working out as we go ahead.
Right. So, since you said that you're working in an NGO, so how important spreading awareness is regarding mental health?
Right. Very important. To be very honest, when it comes to something like mental health. So I come from a family of doctors, right? I mean, starting all the way back to my grandfather, who was a pediatrician in the Navy. I remember jab मैंने I decided that psychiatry is the way I want to go after my MBBS was done and wrapped up with. My parents खुद from the medical field itself, their first reaction was कि पागल हो गया है क्या? पागलों का डॉक्टर बन के तू खुद पागल हो जाएगा, and the usual things that you
Hmm.
hear. So if the lack of knowledge or education about mental health challenges, and people assuming ki pagalpan hi hai, or if it is mental, or the kind of things that people are associating it with, like Ibhas, the Delhi government facility, the moment you step outside the borders of Ghaziabad on this side या करनाल तरफ आप चले जाओ, लोग उसको शादरे का mental बोलते हैं. But it is an institute of national importance, just like Nimhans and CIP in Bangalore and Ranchi respectively. So education is very important. People need to know about how mental health works out as a faculty, just like other things, right? I mean, we have people जो दूसरों के घर जाकर बहुत proudly proclaim करते हैं कि शुगर है, चीनी मत डालना. But if somebody has a challenge with addiction or with managing their dosages and usages of alcohol or other things, you'll never see people go and tell someone कि यार मेरे सामने आप please alcohol consume मत करो या मुझे offer मत करो या pressure मत करो, because it becomes a challenge. And that always boils down to a lack of education, because people think that if you have a mental health disorder, it is a sign of weakness. और छोटे छोटे शहरों में अगर आप चले जाओ या गांव की तरफ आप चले जाओ, तो लोग तो ये भी कहते हैं कि तुमने कोई पाप किए होंगे इसीलिए तुम्हारे साथ ऐसा हो रहा है. And that proves to be a massive challenge, because it's not sin that causes mental health challenges. Just like genetics has a component in hypertension or in diabetes, genetics can have a component to play in mental health challenges as well. And if your diet and your exercise is messed up and you end up with hypertension or diabetes, your diet can also end up playing a role in the kind of diseases that you can expect in mental health. And the only added thing is that sometimes stress ends up causing mental health challenges that obviously शायद बीपी हो जाए, बट मैंने कभी सुना नहीं है कि शुगर से किसी को स्ट्रेस से किसी को शुगर हो गया. But it happens just like any other disease process, and people are not very aware. Very interestingly, India, according to latest WHO estimates, has 0.75 psychiatrists per 1 lakh population, right? And there are concurrent numbers for psychologists, for psychiatric social workers, and psychiatric nurses. They're horribly low. In European countries or in America, you have 6 psychiatrists per 1,000, per 1 lakh, right? And the recommended number minimum is at least 3 per lakh, and we are lagging behind at 0.75. I'm pretty sure हमारे देश में the babas and the ojhas and these people who do this jhad phook and these kind of things, they claim to treat mental health challenges more confidently, and the sheer number is a lot more. India में 10,000 psychiatrists नहीं है, लेकिन उत्तर प्रदेश के 3-4 district में you will probably end up finding 10,000 of these quacks or these so-called shaman-like professionals, right? So that can be a challenge, because people don't know, people are scared. The general consensus always is कि माता आ गई है या मैंने कोई पाप किया है, and that is why things need to be sorted, and people end up with a faith healer. And many a times जो चीज 6 weeks की दवाई and with an adequate counseling session with a psychologist or a therapist could have been worked out, we spend years going back and forth, having ash. We have seen cases where somebody has been given wo raak for so-called treatment by a faith healer, and then they have exhibited symptoms of psychosis. We had sent in a urine drug test to see what was the challenge. They came out positive for everything from cocaine to cannabis to benzodiazepines to opioids, which they have never consumed in their life. But it becomes a challenge, and that always boils down to the lack of education, just like in any other field. If there's more knowledge, if there's more conversation, if it's not all hush hush, then people can sort of find the right kind of help and move on with their lives. So yeah, education is very important.
The problem is not just the stigma attached to going to a psychiatrist or a psychologist. It's also a person is not even sometimes aware that they may be suffering from a disorder.
Absolutely. The simplest example you can take is, depression and anxiety have a lot of what we call psychosomatic symptoms. Psychosomatic is basically मन में कुछ चल रहा है, तो your body is exhibiting these symptoms. People experience body pains, joint pains, fevers, feverish situations, breathlessness, increased heart rate, increased blood pressure. Many a times these could be the direct result of anxiety or depression. But if अगर मुझे रात को 3 बजे घबराहट हो रहा है and I end up at the emergency room of a regular hospital, there is probably going to be a cardiac workup. There's probably going to be a gastro workup if I have acidity as well. But nobody is going to ask you questions as to whether, आपको, if there is a psychiatric issue or if there is a mental health challenge. Because the moment you bring in psychiatry or mental health, people go like, यार हम पागल थोड़ी है. And that becomes a bit of a challenge, because people straight away assume that going to a psychiatrist or a psychologist means that they're crazy. So they don't even want to have that conversation. And if they don't have the conversation, then they don't know that about 70 to 80% of mental health challenges sometimes don't even need medication. You can just go ahead, speak to a psychiatrist or a psychologist, get through your sessions of therapy, and it actually helps you. So yeah, makes a lot of difference that way.
So this is one of the most common questions that is asked. What is the difference between psychologists and psychiatrists?
Absolutely. So, a psychiatrist is somebody who has gone through their MBBS, right? Done their bachelor's in medicine, and then they have gone on to study one of the various degrees that are available, specializing in psychiatry. जैसे MBBS के बाद, if I do MS surgery, I'm a surgeon. If I do MS orthopedics, I'm an orthopedician. If I do MD dermat, I'm a dermatologist. Similarly, you have an MD in psychiatry. You have other degrees as well called DNB. You have something called the diploma, the DPM, or you also have international degrees like the member of the Royal College of Psychiatry. You have the member of the Royal New Zealand and Australia College of Psychiatry. So these are specialized training to deal only with mental health challenges and the prescription of medication related to them. Whereas in case of psychology, the base degrees that take you towards becoming a psychologist, I'm just going to stop and restart because my younger puppy is very
Yeah,
noisy right now.
I'll pause the recording. Yeah, yeah,
So,
please. Yeah.
so when it comes to psychology, a psychologist goes through a bachelor's degree and a master's degree, which can be BA, MA, or BSc and MSc in psychology, followed by it could be an MPhil if they are looking to practice clinical psychology. Many of them specialize in counseling psychology. There is industrial and organizational psychology, people who end up becoming good HR personnel. You have rehabilitation psychology, you have addiction psychology. Psychology in itself, or mental health in itself, has at least 30 to 40 different disciplines. And somebody who has finished their masters can now choose whether they want to go into clinical work or counseling work. The clinical work would mean using psychotherapeutic interventions. Somebody who's a clinical psychologist still is well versed with providing CBT, with providing REBT, with providing various kinds of therapies. In India, we face this challenge that psychology is a slightly unregulated sector. एंड बिकॉज ऑफ दैट बहुत ज्यादा ना प्रोफेशनल्स के बीच में मनमुटाव होता है बिकॉज यू गॉट दैट थिंग दैट हे आई एम एन एमफिल I have an RCI license, so I am better than somebody who is just an MA and probably has a counseling or an organizational psychology degree. But that's not the truth, because everybody has their own specialization. And ऐसा तो है नहीं कि if as a psychiatrist I'm like I'm going to do all the work in the world. The kind of things or the kind of stuff that you deal with, the trauma that people have gone through, the information that they share, nobody has the capacity to see detail mein, for 45 minutes to an hour. To keep yourself sane, you cannot see more than 5 or 6 patients a day, or maybe 8 a day if you're really good at compartmentalizing. But having said that, which means that due to the sheer lack of professionals, every professional has their specialized place. And it is very important to realize that a psychiatrist or a counseling psychologist or a clinical psychologist or a organizational behavior psychologist or an addiction psychologist, everybody is supposed to do their own work like a well-oiled machine, or how the clock functions. You've got a clock with all its paths, जो हमें बस टाइम की घड़ियों जैसे घड़ी के वो कांटों जैसे दिखता है. But if everybody is doing their work properly without criticizing each other, without talking crap about each other, then there's a lot of work to be done in mental health. We have a very sheer, lack or paucity of professionals. And it would really help if people were like, I'm going to do my work, I'm going to do this and that. But yeah, slightly challenged there as well. So
do you
hopefully
believe
things
in
get better as we go forward.
Yeah. Do you believe in the integration of psychologists and psychiatry, like talk therapy and medication should be given?
I do, absolutely, absolutely. Whenever I talk to people, whenever I talk to an audience, in fact, very recently, I spent time with the medical officers of West Delhi, जो government dispensaries है, PHCs, CHCs, the Delhi government dispensaries. I ended up talking to about almost 65 doctors, barely 4 to 5 days back, right? It was when we started the whole interaction, they were like, "हाँ, हम doctor हैं." It's a good thing. We have knowledge, but when we spoke about it, and people were willing to learn. people were willing to ask questions. And, that was a big surprise because some of them have been practicing for the last 20, 21 years. And, I have just started practicing like 5, 6 years back. So trying to tell them that in cases like schizophrenia and bipolar disorder, jahan pe you have a major hormonal component or a neurotransmitter component, or jahan pe insight nahi hoti. Insight is a concept of knowing that something is wrong with you, right? In schizophrenia and in bipolar mania, the chances of insight are a little low in the beginning. So in these cases, medicine probably does 80% of the work, and then psychotherapy comes in to offer 20% of the work. Recognition of symptoms, जब चीजें बिगड़ती हैं तो उसको recognize करना, or even after medications, if you're still hearing voices, knowing the difference between what is real and what is not real. The best example of that is the movie A Beautiful Mind, based on the mathematician John Nash, where Russell Crowe, portrayed it fantastically. But the point is that it was at a time where medicines were not available in a regular flow or quantity, or even the sheer number of salts was not available. That man ended up with a diagnosis of schizophrenia, and after getting better, he won his Nobel Prize a lot better after he was diagnosed with schizophrenia, right? And even at that time, with the lack of medication and till the end of his life with his hallucinations present, he could still see a psychotherapist who taught him the difference between what is real and what not. It was portrayed very beautifully in the end of the movie where he asked his, ki, is this real? That insight was developed by a psychologist. इंडिया में साइकाइट्रिस्ट, लेट्स फेस इट, डॉक्टर है, भगवान है, थोड़ा गॉड कॉम्प्लेक्स रहता है. सो वी डू दीज ओपीडी टर्नओवर्स इन लाइक 5 to 10 minutes. अच्छा, तेजी आई है, ये दवाई ले लो. उदासी आई है, ये दवाई ले लो. But that is symptomatic treatment. You're not really addressing the root cause. In cases of schizophrenia and bipolar mania, perhaps the root cause is being addressed by the medication. But the psychologist has a beautiful role to play where they are bringing in insight and making them recognize. So, just like John Nash, you could also ask that question, ki, maybe this is not right. Maybe what I am seeing is not real, or maybe it is not true. So in schizophrenia and bipolar mania, 80-20 medicines and psychology. In OCD, obsessive compulsive disorder, I would say it's a 50-50 thing. Right. Medicines and therapy are equally important. There are studies that show जिनमें दोनों का involvement हुआ है, you have very less recurrences after people have gotten better. But in cases where only medicine or only therapy was used, cases tend to come back again. Right? And then when it comes to mild to moderate anxiety and mild to moderate depression, which has a trigger, like I have dealt with a lot of anxiety in my life. Right? Even after finishing with my progress in my education, उसके बाद भी 3 साल बाद मुझे realize हुआ कि boss, what I am dealing with is anxiety. That is the level of a lack of knowledge or conversation that we have about these things. And eventually I ended up seeking help with a therapist, spoke to friends who were psychiatrists. Luckily, they were the kind younger psychiatrists who believe that medication is not the end-all solution to everything. And even they said, ki, boss, go seek help with a therapist. And if it doesn't work, agar dawai ki need hoti hai, if there is, this point where you're getting stuck, we will make sure that you get the meds that you need. And that worked out. So for these common day-to-day challenges, jahan trigger-based hai, the best way to explain it is, if I am an ostrich, Shaturmurg ke bare mein kaha jata hai that whenever there is a problem, it shoves its head into the sand or the mud. Problem dikh nahi rahi hai, to problem hai nahi. So if I have an emotional trigger from my childhood and it is causing depression and anxiety, I can take an antidepressant, I can take an anti-anxiety. It is pressing the depression and the anxiety down. But jo trigger hai, my childhood trauma or anything of that sort at all, these triggers don't really go away with the medication. I am just pressing or depressing the symptoms that come with it. So in these cases, it is probably 75 to 80% work with a psychologist, and medicine will take a backseat.
Plus, anti-anxiety medicines cannot be used for very long, right?
Absolutely not. So I also own, I totally forgot to mention this, I co-own a rehabilitation facility in Chhatarpur. We started out with the whole Alcoholics
What's the
Anonymous
name?
and Narcotics Anonymous. It's called Umeed Wellness. We rented out a place in Chhatarpur, and we started using the Minnesota model, basically the AA and the NA work that happens, right? Where we believe that medicines, agar hame use karne hai, to they function only for the withdrawal period. If I am, say, for example, if I am consuming heroin, the day I leave heroin, my withdrawal symptoms are going to be diarrhea, muscle pain, lack of sleep. I can give you medications for all of these. But you choosing not to do heroin again, or whatever drug whoever prefers again, is more of a mind thing than a physical thing. Because as soon as the withdrawals are over, your body is not asking for the drug. You are probably using it as a coping mechanism. कि यार problem है, झिला नहीं रही, let me just have my fix and I'll forget about the problem. Again, the whole ostrich situation. I remember that we had this gentleman who got admitted. There is this sleeping pill called Zolpidem. Zolfresh के नाम से market में मिलती है.
It's a benzodiazepine.
10 milligram. It's a hypnotic. It is close to the family of benzodiazepines, but it doesn't work with anxiety. It works only with sleep per se. So this gentleman picked up the habit of using Zolpidem as well as a benzodiazepine by the name of clonazepam, जो Petril, Zappis, इन सब brands name में बहुत common मिलता है. So he went to the chemist one day in a smaller town in Haryana, and they were like, अच्छा घबराहट हो रही है, नींद ना आ रही, ये दवाई ले लो. दवाई दी. And when this gentleman was admitted with us, he was consuming 22 strips of this tablet on a daily basis. क्योंकि start एक से किया था और अभी 22 पत्तों में भी उसको
tolerance builds up very quickly in benzo.
It does, and it is insane. And the problem is that just because I am giving or somebody is giving a quick fix, कि हाँ यार ये ले ले, खाते ही 5 मिनट में आराम मिल जाएगा. You could be using a proper antidepressant. You could be using a proper antidepressant from the family of SSRIs, selective serotonin reuptake inhibitors, that also work on anxiety without causing sleep. या फिर antipsychotics along with therapy, which means that जैसे जैसे improvement होता है, you can take off the medication. And it functions like TB. 6 महीने, 9 महीने, साल भर. It is given in lower doses or manageable doses ताकि side effects ना हो. People are able to get off medication when needed as well. Somebody who has schizophrenia or has bipolar disorder may have to continue with 1 or 2 tablets for a lifetime, just like in diabetes and in hypertension, and that's okay. But we still have 80% of disorders जहाँ पे हमें lifetime medication की need नहीं है. And it is very important to, again, comes back to the first question, where we were talking about education, how important education is. So yeah, it becomes a challenge, and there is this host of disorders where only 80% of the work has to be done by a psychologist, and a psychiatrist plays a supporting role. And perhaps in that case, I am not the top god or whatever I want to be. It's somebody else, and I'm playing a supporting role, and we have to recognize that. So yeah, it becomes a thing.
Beautiful. The sad truth is that most people try to self-medicate, or the chemist themselves give them schedule-H drugs, psychotropic schedule-H drugs, that like benzos, Ultracet, and it further adds to the problem.
It does.
So if we talk about substance abuse, let's assume that the person is suffering from substance abuse disorder, right? So do you think he must have also been, there's some root cause like lack of proper coping mechanism or depression or anxiety because of which he's falling to drugs?
There is a big possibility. Let me give you the example of my really good friend who's a cardiologist now. I remember when we were in first year of college, and किसी भी लड़के का, we had 52 boys in our batch, right? तो किसी भी लड़के का जब ब्रेकअप होता था, तो this guy would go like, अच्छा ब्रेकअप हुआ है, ये ले, दारू पी ले, सब भूल जाएगा. अब हम लोग उसको मजाक की तरह ट्रीट करते हैं. वी गो लाइक, हाँ भैया कार्डियोलॉजिस्ट बन के तुम यू वर क्रिएटिंग योर ओन पेशेंट्स इन योर ओन बैच. वी जोक अराउंड विद हिम अ लॉट. बट द थिंग इज, it is generally the avoidance of some kind of emotional trigger or some kind of situation where we think, ये मेरे से झिलाएगा नहीं. And because I cannot handle that situation, I end up taking alcohol or cocaine or cannabis or a sleeping pill for that matter. Because if I'm going off to sleep, I'm not really dealing with my problems. If my senses are altered, I'm not really dealing with the shit that I actually have to deal with. And let's face it, dealing with things is a lot more difficult than, taking a shot
Mm.
of vodka
Of
or a few
course.
shots of vodka and, forgetting about the problem. So eventually, as a human being, we end up looking at the easy way out, right? Not necessarily that it's only problems that become a reason as to why somebody starts using alcohol or drugs. It could be peer pressure. It could be, the portrayal of certain things in the media. Uh, I remember there was a time when, Marlboro के अगर आप पुराने ads जाके देखो, back in the
Cowboy.
50s and the
Marlboro Man.
60s, the Marlboro
Right.
cowboy, it is
Right.
associated with, a masculinity or,
Masculine, yes.
that kind of a thing. I still remember there was a time when Marlboro had managed to get a recommendation saying that it is recommended by doctors. You can actually
Yes.
go ahead and look up this, anybody can look up this advertisement where you had full page ads where it talked about how doctors recommended your cigarettes. And things like these, be it marketing or, where you have cold drinks के लिए तो चलो I still understand, the whole Mountain Dew thing where you have got डर के आगे जीत है and all of that, it makes you feel like कि हाँ मैं भी अगर Mountain Dew पी लेता हूँ I become Hrithik Roshan, or if I'm consuming Thumbs Up I become Akshay Kumar, or whoever these fancy active heroes are. But it's like the WWE. There needs to be a disclaimer at the beginning of every stunt or every match that all of this is not contributing to your manliness. This is just a marketing technique. Very interestingly, all of these marketing techniques are also based on psychology because they are messing with your head. And people then end up consuming these substances and they think, "Ha yaar, hum to mard hai," or we are the cool people. I remember Kabir Singh was very damaging to a lot of people. I had so many people going like, "Ha yaar, even I am a medical professional. Even I can do shit like Kabir." No, you cannot. I mean, it's not cool to be drugged up, and it is not cool to be drunk or this thing when you are performing important operations or interacting with a client or dealing with your relationships. Forget everything else, right? And not many people again have that recognition, but we are getting there. There's a lot of talk. You have a younger breed of mental health professionals who are actually working towards making this change. People are more aware. People in cities, in Delhi, somebody will probably ask 20 good questions, right?
Hmm.
Why am I taking this medicine and what is the reason why I am doing this? कभी कभी irritating हो जाता है because people go to Google and they assume that every side effect in the world is only going to happen with them. It also gets irritating when you put somebody on medication for 10 to 20 days or 30 days for alcohol withdrawal. And the first question they ask is, iski, terribly sorry, terribly sorry. I'll just restart that part. I totally forgotten my phone was not on silent.
No, it's fine.
So, yeah. So, I was at, yeah. So, when you have people coming up to us and going कि यार आप हमें alcohol withdrawal की दवाई दे रहे हो, इसकी लत तो नहीं लग जाएगी. Dude, you have been drinking with an addiction level for the last 30 years, and are you really that naive? क्योंकि just because you read on Google कि it has an addictive possibility, there's a reason why I have put in 10 years of education and I'm sitting and educating you about this. But unfortunately, people don't ask that many questions when they consume drugs or alcohol or cigarettes. But dawai lete time, there are a lot of questions. And why sensible questions are welcome, I love to answer those. Um, Generally, my single consultation, I remember when I was at IBHAS mein aap din mein, in an 8-hour period, you're looking at about 200 patients. You really don't have the time to, sit and engage with everybody. But as a private practitioner, I end up spending about 45 minutes to an hour with every patient of mine because in mental health, it takes time to open up. And if I can instill that confidence, ki, ha, boss, I have heard every part of the challenge that you are facing and then offering medication, people are more willing to learn, people are more willing to listen, people are more willing to comply. And that itself sort of sets off the education process because, like that really weird Salman Khan movie, Jai Ho, मैं अगर एक पेशेंट को बता रहा हूँ, वो 10 और लोगों को जाके वो इन्फॉर्मेशन शेयर कर रहा है. And and that's a good thing because it starts a very good chain reaction. So yeah, again, education is very important. So that makes a lot of difference there.
Speaking on the demographic of your patients or any patients of a psychiatrist, how many people in the youth would you roughly say are suffering from substance abuse?
Substance abuse is if we go by national figures, then it is anywhere between 10 to 16% of the population. But if we look at city demographics, right? So my major practice concentrates around the areas of Delhi, Noida, and Gurgaon, and the adjoining areas. Substance abuse is a lot higher here. And as time progresses, it is getting higher. A lot of people took up to consumption of alcohol with a vengeance जब पहला lockdown खुला था and alcohol was available, because somewhere they thought कि oh, I was deprived of my rights and now I'm going to do it a lot more. And you'd be surprised at the number of casual drinkers who actually turned into a substance use disorder during this pandemic time. In Delhi, the use of cannabis is very high because I'm guessing it's easily available. I remember where I had friends in Amity in Noida who would talk about ki bhang theka hai in front of this particular gate where it is very easily available. Or you've got kids coming up to the OPD and talking about ki West Delhi mein there is this particular mall where you can take an e-rickshaw and then go and procure your supply of cannabis and other drugs. The easy availability and the lack of education about what it can do to you increases the sort of consumption. And I think it hovers, there are no official figures, but if I were to break down or analyze the patients I end up seeing, I would say it's closer to a 40 to 50% of people using them pathologically. मतलब not casual use कि हाँ कभी एक बार party में कर लिया या went out, took a sol with my friends, so that is when I decided to do it. But on a daily, regular basis, we've even got 16, 17-year-olds who are using it. And it runs up to 1 or 2 joints in a day, cannabis itself. So the numbers are pretty high, especially in a city like Delhi.
Is there any correlation of cannabis and psychosis?
Yes. So it's a bit, for the lack of better describing words, it is a bit like a lottery. ठीक है? You have these old जो ताऊजी टाइप के लोग होते हैं sitting in Haryana with their what do you call them, their hookahs, जिसमें they are putting in tobacco and they're putting in cannabis and things like that, smoking for 50 to 60 years but have not exhibited symptoms of psychosis. But there are also people who have tried it one time and have gotten to show symptoms of psychosis. Right?
Those who have
The
a
thing with
biological
cannabis,
history of schizophrenia.
those who have a biological history, who have a family history,
right,
who probably don't even have a proper family history, but उनमें genetic component है, express नहीं हुआ है in certain family members. Maybe we look at 3 generations previously, and उन 3 generations में शायद किसी को भी proper schizophrenia या proper psychosis नहीं है, but maybe they have also not consumed cannabis and things like that. So there is a chance that you might end up contracting contracting is the wrong word to use because it makes it sound like an illness that spreads through touch or whatever. You might end up exhibiting symptoms of psychosis, and cannabis can definitely contribute to that.
right. So when patients come to you, how hesitant are they to use medications? Are they unwilling because of the side effects?
People are very unwilling to use medications. They're obviously worried about the side effect profile. They are worried about कि अभी दवाई जिंदगी भर खानी पड़ जाएगी. They are also worried about कि if, and this is something we've very commonly noticed with younger female patients, their parents are desperate to get rid of the medications क्योंकि अभी शादी करनी है और in-laws को बताना नहीं है. So yeah, there are a host of social as well as other apprehensions which make people not want to consume medications. But I think then it is the duty of the attending psychiatrist or the mental health professional to explain to them why it is going to happen. And no medication means that eventually it is going to get worse. We've also had cases where people have stopped medication for their daughters क्योंकि शादी करानी थी, शादी करा दी, and then symptoms came back and the daughters were sent back to their maternal homes, and
Right.
it has broken families. So yeah, it can be a bit of a challenge, but we are hoping to sort of again get people educated कि जैसे आप तो यार proudly शुगर की दवाई खा रहे हो, बीपी की भी खा रहे हो, तो ठीक है, इसकी भी अगर खानी पड़े तो it's not a challenge,
So
and
that is
that's important to
actually
get across.
treating the symptoms only that can be
It is treating the
socially
symptoms.
negative. Yeah.
Absolutely.
So if we speak about comorbidity, like if someone is suffering from bipolar mood disorder or schizophrenia, how likely are
Right.
they to say suffer from anxiety as well or psychosomatic
It
disorders?
right. It depends. So in bipolar mood disorder, जहाँ पे आपको depressive symptoms ज़्यादा है, because bipolar disorder is basically the highs and the lows alternate. In a very basic essence, there are 4 criterias of bipolar disorder, जिसमें किसी में highs ज़्यादा रहते हैं, lows कम रहते हैं, lows ज़्यादा रहते हैं, highs कम रहते हैं. In the lower states, there is a possibility of anxiety coming in more. Having said that, higher states में भी रह सकता है. Anxiety is something that also becomes a bit of a personality trait, depending upon how we have grown up, right? So if you had a lot of triggers in your childhood, if you were a bullied child, or you were there's a lot of comparison between children in the family as well, कि और पड़ोसियों के बच्चों के साथ. So things like these can contribute to an anxious personality. So if there's an anxious personality, irrespective of what diagnosis they have, be it schizophrenia, OCD, psychosis, pure, schizophrenia is a host of symptoms. Psychosis भी होता है, delusions भी होता है, बहुत कुछ होता है. You have phobias and all of these. So you could have anxiety as it is. But it is taken as a rule of thumb to simplify it for an audience, a lay audience who's trying to listen, that in cases जहाँ पे serotonin deficiency होती है, there are higher chances of anxiety showing up. So basically, anxiety in itself is associated with decreased serotonin. So is depression. So is OCD. So are phobias. All of these are associated with decreased serotonin and can show concurrent anxiety symptoms along with them.
If we want to naturally increase the level of serotonin, sunlight, exercise.
Exercise helps. Sunlight, unfortunately, doesn't. A good diet helps. Right? This is a very interesting thing with serotonin and alcoholics. Generally, when somebody starts consuming alcohol because of anxiety and depression as a management tool, initially it will control your anxiety and depression. But in the long run, it makes you more anxious and more depressed than you originally were. This happens because serotonin ka basic building block is an amino acid by the name of tryptophan. Tryptophan is absorbed only through the gut, through the stomach lining and the intestinal lining. And if it is not absorbed, the serotonin banta nahi. And if you're consuming alcohol, then tryptophan is not absorbed. So it is a bit of a vicious cycle. मुझे anxiety थी, मैंने alcohol consume किया, अब tryptophan absorb नहीं हो रहा है, serotonin नहीं बन रहा है, and back again to anxiety.
Plus the number
if
of
somebody is dealing
GABA receptors also decrease, right? So that you cannot naturally produce calming.
Absolutely.
Yeah.
I mean, they also need to have a place for them to act. So if they are reducing and the quantity is also low, or the time duration for which your neurotransmitters or neurochemicals are available, even if that is reduced, so it's an all-round effect which is pushing you further into depression and to anxiety like quicksand. So it becomes a bit of a challenge there as well.
So my question is, how many trials and errors in the art of psychiatry is it needed to get the correct medication?
I would say it actually depends from person to person. It depends from practitioner to practitioner. But I think I am a bit of an elitist when it comes to this. मुझे लगता है if I'm able to solve somebody's crisis in less medicines, then I'm doing greater justice to the art of medicine. So Trial and error for me usually works out at changing one drug at the most. But even then, the decisions, because I end up spending about 45 minutes to an hour with a person, the history is really comprehensive. I
Right.
try to take in family history, consumption of substances, their screen time, the amount of lights that are there in your house at bedtime. Because if there is light falling on your retina, it
Melatonin.
does not allow your pineal gland to produce
Right.
melatonin, which means bad
Right.
quality of sleep. If अगर उसी से मैंने solve कर दिया तो मैं दवाई क्यों दूं? I can just give them better
Hmm.
sleep hygiene, right?
Hmm.
So yeah, I think it depends on how observant you are as a mental health professional. Because if you're asking the right questions and you're coaxing out the right answers, you can sometimes keep things at a minimum. You probably don't need as many pills or a higher degree. Like for BPD, now that you bring it up, for
Hmm.
which is borderline personality disorder,
Hmm.
there are patients जिनको lithium prescribed करके we have shifted them to a salt like lamotrigine,
Hmm.
and there are patients who have never been started on lithium depending upon the exact condition that they are at that point of time, and that does not come through a 5 or a 10-minute history. It has to be a comprehensive history. You cannot
Right.
make a In many cases, you cannot make a sure shot diagnosis right at the first go. As a mental health professional, I have to be willing to realize that kabhi kabhi us 1 घंटे में भी the person may not be comfortable enough to share all the information that they have, and I'm
Hmm.
going with a provisional diagnosis and starting medications to see if it works. But 3 days later, with this new medication, they might achieve that level of comfort where they're like, "Ha, we have this as well," and then you need to have the conviction to go like, "ठीक है यार, शायद ये need नहीं है, let's switch back." Or let's go to something higher or lower depending upon the need of the person. So that is an area that perhaps all of us need to look at. And but then there are a host of challenges associated with the financial aspects of mental health
Yes.
practice as a psychiatrist. And I'm guessing it is just profitable to see patients, और forget even profitable, घर चलाने लायक भी पैसा तभी आता है if you are cycling through a lot faster.
Hmm.
And that can be a bit of a challenge again sometimes, but it is something that people are recognizing, people are working towards. uh, Things are changing. Yeah.
How often do you have to turn to psychometric evaluation or a standardized test to diagnose the patient?
If I see that there are challenges with personality, then always.
Right.
If there are challenges with what I think might be a childhood trauma or adolescent trauma, or something that they might have dealt with, I generally tend to make a reference then and there to a psychologist who could be doing psychometric testing immediately.
Right.
Or, as per mutual convenience of the schedules of both the psychologist as well as the person needing the psychometric testing. But in cases of hallucinations and delusions, initially when somebody is very aggressive, when somebody is very violent, then we try to go ahead and start the medication. And so the new Mental Health Care Act 2017, right? It talks about admission being recommended only in 3 states: when somebody is a harm to other people, when somebody can be a harm to themselves, and if self care बिल्कुल खत्म हो गया है, 3 महीने से नहाए नहीं है, बाल बड़े कर लिए, नाखून बड़े हो गए, and all of that stuff. So in these cases where somebody is meeting these 3 criteria, that is when I go like, ठीक है यार, maybe if I am spending 1 hour testing and they end up harming somebody else or themselves, I might as well start medication first and bring them to a point where they're not a danger to anybody. And then you
Hmm.
can work with the psychometric testing. So yes, psychometric testing is done everywhere and should be done everywhere, but the timing of where you introduce it depends on a case-to-case basis.
Right. And if a person is taking psychiatric medications, would you recommend them to not drink or take any self-medication or drug?
Absolutely. Absolutely. For the simple reason that, if I have psychosis,
Hmm.
psychosis ka basic mechanism of action is कि it is somehow reducing dopamine or blocking the dopamine receptors, right? अगर एक तरफ मैं वो कम करने की कोशिश कर रहा हूँ and then I take cannabis and cocaine and get my dopamine to shoot through the roof, there's no point. Similarly, in depressive cases, if I'm trying to block the serotonergic receptors, or trying to increase levels of serotonin or keeping them for a longer time, then I'm taking alcohol and heroin, which is pushing my serotonin down.
Hmm.
Again, no point. I might as well do whatever the heck I want to. So over there, the education process plays a very important role. When it comes to psychiatric medications, I personally tend to follow a all or none rule. If you're doing your meds, please keep off the substances, because they are contributing to a flux in your neurotransmitters, and wo flux ही है that is causing problems. So
Hmm.
why, it's like I am filling a tank with water, but मैंने खुद जाके उसमें छेद भी कर दिया, so there's no point. So that
Right.
is something again which has to be sort of shared as part of the education process.
So, sir, do you believe in a holistic approach, like aside from giving patients counseling and medication, uh, recommending them exercise or proper diet, like you said?
I do. I do. So the sleep hygiene thing is a recommendation that goes to
Yes.
everybody nowadays, because all of us are using devices. Most of us, in fact, there was a time when the first lockdown hua tha, and for the first 20-30 days, even our OPDs were shut down. We weren't going to the hospital. I
Hmm.
would be sitting and watching. I don't know. मैंने अपनी जिंदगी में इतना Netflix नहीं देखा है जो मैंने first wave के first lockdown में देखा होगा, right? And if I am sleeping at 3 a.m. in the morning and sunrise is happening at 6, I'm not getting the adequate dosage of melatonin that my brain requires for a good, restful sleep. So if I'm able to solve an issue by creating that space where somebody is, managing all of this by themselves, then it's a good thing. Diet also makes a lot of difference. Exercise obviously contributes. And I also believe with, vehemence that it is not only traditional therapies like CBT, cognitive behavioral therapy, REBT, and all of these that function. I think hypnotherapy, all of this also has a very important role to play, and I think we as professionals need to open up to the idea where if something has not been disproved and there is not enough work on it, then we can't say कि ये काम नहीं करता just because I believe my method is better. If that was the
Hmm.
case, then we would have still believed, that Earth is the center of the universe like idiots, or the Earth is flat, and things of that sort. Right? But somebody questioned an established belief, brought in a new method, and then we are better off for it. So similarly, I think that same kind of openness should be there in mental health as well.
Sure.
So yeah, hopefully that works.
My last question would be, how much importance should a psychiatrist give to supplementation, like fish oil for depression or vitamin D for boosting mood and magnesium?
Right. I think it is really important. In fact, psychiatry in itself does not have many investigations.
Hmm.
CTs and MRIs are not going to give you an answer unless there is an injury or things like that. Blood tests may be ginke, diagnostic blood tests, vitamin B12, thyroid, and vitamin D3. In fact, I remember as a final year MBBS student when you're making those mnemonics to remember कि किसका आंसर क्या है, पूरे साल पढ़ाई नहीं करी, अब तो रट के आंसर एग्जाम देना है, and things like that. Vitamin D deficiency used to be called 3Ds.
Hmm.
3Ds would be depression, diarrhea, and death, and sometimes even dementia. So, अगर depression हो रहा है due to the lack of vitamin D3, so I might as well give them vitamin D3
Right.
supplementation and
Makes
then
sense.
improve that status. If that has
Hmm.
been achieved, then we know कि यार ठीक हो गया. उसके बाद भी अगर depressive symptoms है, then we can target trauma, we can target their hormonal issues. But then hormonal issues या neurochemical issues are all experience based. You share information with me, I bring in my observation, and I try and prescribe the appropriate medication. There is no blood test that is going to tell you कि आपके दिमाग में neurotransmitter levels of neuro sorry, more like at the neuromuscular junction level or the receptor level, how much serotonin or dopamine is there in your brain. In fact, very interestingly, when it comes to money making exercise, there is only one organization in Delhi that is currently tied up with a lab in Germany. They take your blood samples send it to Germany, and then 15 days later आपका report आता है that says आपके blood में, at your serum level, how much dopamine, serotonin, adrenaline, noradrenaline, falana you have. And each of these tests costs 45,000 rupees each time you get it done. So अगर मैंने दवाई start कर भी दी, blood level पे और CSF level पे, these things being available is a different ball game altogether. Right. So at that point of time, but vitamin D levels, vitamin B12 levels, easily done, comparatively सस्ता है, 45,000 तो कतई नहीं है. So you can get that done and see if that is a challenge, if thyroid is a challenge, and if you can solve those, then you can also target the other issues concurrent. So it is important to, take a holistic approach. I mean, I probably will now have, as I am growing in my career, I sometimes am scared that I sound anti-psychiatry, it really scares me that I sound
you
very
said it was
anti of
money
my
making.
profession. है ना? But then the money making thing is for a lot of spheres of medicine now. And I think that is not to do with doctors themselves, but a lot to do with the fact that corporate houses have taken over the whole medical space. Right? If you think major groups, be it, I'm not going to take names, me and you are going to end up getting sued at the end of this. But major corporate houses, if they're taking over hospitals, they function like corporates. They give targets to their doctors. आप target meet नहीं कर रहे हो तो आपके पास job नहीं है. And then everybody starts to function like a salesman. Right? So that is where probably the money-mindedness comes from for everywhere. Right? कि admission आते ही, in fact, when you are crossing the new Mayur Vihar flyover, the latest one that was built, going from Noida to Delhi, I remember जब वो flyover नया बना था, there would be advertisements from a major corporate group that said, surgical packages guaranteed not to increase costs. Matlab, those are the kind of guarantees that you have to offer to people to get them to come to your hospital or to your medical premises. And that is where the financial challenges come in. My gripe with, myself being anti-psychiatry is not so much as कि I am anti the subject, but I am anti the fact that सिर्फ psychiatrist ही है जो हर चीज solve करेगा. The psychiatrist, the counseling psychologist, the clinical psychologist, the addiction psychologist, the rehabilitational psychologist, the nutritionist is just as important in that grand scheme of things, just like everybody else is. And luckily, that was something I also saw reinforced at Vimhans. I spent about 2.5 years at Vimhans, and that is something that is actually followed there. And that is something that is also followed in good, mental health care systems like the NHS in the UK or, the Australian healthcare services, where everything is given due importance, education is given importance. Patients are, हमारा lunch hour meetings hota tha, where we would be cooking food with the patients, semi-cooked or pre-cooked food, air fryer mein bana liya, ya fir, you have those cupcake making machines, we would cook food in that. And that contributes to your overall wellness. It's not like the early 80s या फिर वो जो जैसे तेरे नाम movie में दिखाया था, you've put somebody in shackles and you're giving them ECT and you're locking them in a room. That is not how mental health should function, because nobody is a criminal, right? I mean, it's interesting that there was a time when it used to be called being criminally insane, and the first act was the Indian Lunacy Act and not the Mental Health Care Act. But times have progressed. We have better medications. We have a better class of professional available when it comes to counselors or therapists and other professionals. So it is very important for all of us to get together and work, because there are many psychiatrists who will say, what are you psychologists doing? You're sitting in a closed room talking, doing nothing. Psychologists will say, what are you psychiatrists doing? You're just, prescribing addiction-based pills. But if we, all of us, stop talking shit about each other and recognize that in every case, every professional has a role to play, which might be, ebbs and flows. कहीं पे psychiatrist ज़्यादा है, कहीं पे occupational therapist ज़्यादा है, कहीं पे psychologist ज़्यादा है. If we recognize that, fluid change of roles that we have, I don't see why mental health, should turn into, currently statistics say that by 2030, depression is expected to overtake TB and infectious diseases as
No
the single
surprise.
most common diagnosis in the country.
Right.
But अगर हर कोई इसके बारे में बात कर रहा है, there's education and people are talking about it and people are getting the right kind of help, I don't see why we need to go there. And that is so it's not anti-psychiatry, it's more like pro all people mental health. Everybody
Right.
has a brilliant role to play, and we as professionals, each and every one of us, should be more accepting of that. Because if we are not, then we are then we are just like those corporate houses that are looking to make money, and we're not really honest to the profession or even to ourselves. And it is important that we do that. So
Right.
hopefully the younger breed of professionals is getting there, and hopefully we'll also sort of see massive changes over the next decade or so. So let's see how it goes.
Thank you so much for spending your valuable time, sir.
It's great. I mean,
I'll
you
stop the
asking
recording.
the right kind of questions to sort of get information across to people. It's a good thing, because lack of knowledge is a big challenge. Right?
It is, especially in India.
Yeah.
I'll stop
I mean,
the recording,
I
sir.